This is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. This session is about transport of acutely or critically ill patient. Patient transportation is always a challenge. Presence of human being, it can help to solve some of the problems and the challenges. Sometimes you need to carry your family member in your shoulder, and even in high resource countries, sometimes people reside in places where there is no elevator and you need to use modified ways of transportation. Throughout the history, people are trying to improve patient transfer by making locally made stretcher to stretcher with wheel till we have the ambulance and even air ambulance. With the current sophistication, you need to carry the patient plus the monitoring equipment and life support equipment plus the pump that giving them medications. In this slide, I am showing you the old map of Khartoum Teaching Hospital. You see the spread of the units. You see the emergency and accident emergency, the CT scan, you have to travel there. The ICU is close to the OR and X-ray is somewhere else and the dialysis. So your patient has to go from one place to another place. Imagine you have a critically and seriously ill patient and you need to navigate them from one place to another. If I want to make a dream, my dream will be to reconstruct these units close to each other so I can move my patient easily from one unit to another. Even with that, you cannot prevent bad consequences for patient transportation. So the best preventive measure is not to transport. The objectives of this session to ensure safe transfer or transportation of a critically ill patient to facility that can provide a better level of care to and from diagnostic facility required to allow better management of the patient's condition. First, let us define who is critically ill. Critically ill patients are those that by dysfunction or failure of one or more organ system depend on survival from advanced monitoring, instrumentation, and advanced therapy. The safe place for critically ill patient is the ICU, where you have a controlled environment with a physician leading the team with a nurse present to care for the patient all the time, respiratory therapist there with good plan of care, patient connected to monitoring equipment with all infusion pump running and sophisticated ventilator and with good communication plan between the team members and the team and the family. Case study: 68-year-old man admitted to ICU with fever, hypertension, and confusion. No clear source was identified. In the second day, he developed abdominal distension and tenderness and with rebound tenderness and guarding. The surgical resident recommended CT scan to rule out intra-abdominal infective process. Regarding the previous scenario, so what would be the best action? This is a critically ill patient and we cannot move him. ICU care is more important than radiological studies. Weigh and balance the benefit of and risk of sending him for this study. Ask hospital administration to provide portable CT scan. Minimize the risk of transportation by arranging for appropriate equipment and staff. ICU patients need to go to radiological department, operating room, or other hospital. Moving this patient may lead to dislocation of installation, drips, equipment might malfunction, and also there is reduced availability of personnel, equipment, monitoring away from ICU may be detrimental. The first indication that transport within hospital is dangerous undertake was provided early in 1970s when arrhythmias were encountered in up to 84% of transport of patients with cardiac disease, which require emergent therapy in 44% of cases. Transporting mechanically ventilated patient might lead to hypotension and arrhythmia. What can go wrong during transportation? Regarding equipment, ECG leads might disconnect, monitor power might fail. Also, there can be disconnection of intravenous line, intraarterial line, and from mechanical ventilator. A moment of thought, the decision of transporting a patient in serious condition is a medical action. This is a medical decision. Therefore, the responsibility is ascribed to the doctor who is attending the patient. We have to weigh and balance the benefit and risk before transporting a patient. And when we go back to that scenario, the guy who needs CT scan, we need to weigh and balance if the CT will add more to the diagnosis. Since the patient is a clear surgical abdomen, it is better you take him directly to the OR. Thank you, and we'll continue the session in the next slides.